There's a couple questions up here.
And Dr. Wade, you do not have a bull's eye on your shirt, so.
Oh, I do. I have it right.
This is not directed to you personally. We're talking ideas, I hope, here.
Yep.
Your closing remarks to your introductory comments, help me remember exactly how you phrased that. Your goal or your ambition for the evening would be to challenge us to use the resources and gifts that God has given us to see them wisely or make good choices.
Yes,
Was that your phrase? Something I rarely hear among the Christian community is this basic concept. If government takes over a social service or an admonition that God gives to us as Christians or His people or the church or the community to do, and there is a little g government and a big G government, if big G government takes over that responsibility and confiscates our income and our resources through taxes that we have no option to pay, we have no choice. So then the person who pays those taxes, whether they want to or not, are they morally equivalent to someone who would like to help people? They're both helping people, but the freedom of choice has been completely removed from that equation. Is God going to hold, is God going to grant us, is God going to look at us as giving, caring people when we had no choice in that? It was confiscated by force of law from us. In that system, God did not even create on earth for His people. He gave us free will and free choice. And I would just like to make the case, when it gets to that, you're taking away the opportunity for free people to give freely. And you're putting everyone on the level playing field of being slaves to a false god of government. I unfortunately lost my sister last year with pancreatic cancer. It was interesting. She had insurance, she had health care, but there's just simply nothing they can do for that.
Right.
Some people may have screamed and cried, why can't somebody do something? Doctors ought to be able to do that. Somebody ought to be able to invent a solution to that. But she knew Jesus. It was the most wonderful thing to see my sister go home to heaven. Sin is a fallen state of the world. There's not a lot we can do about it, and death is a part of it. Having said that, I don't garner a lot of respect for our chief officer of the nation when his brother in Africa lives in a grass hut with no assurance that it was mechanically well built, that it has no government approval, he has no government insurance, no dental care, and the president's done nothing for his brother voluntarily. Yet he appeals to our moral values and sense of moral values to cooperate with a government confiscation of our resources. I would make the case that the government debate in the public arena today is more about control. It's more about someone having control over the population and directing them. Now, you made the judgment call earlier that you thought Americans probably had too much of their own way or doing their own thing. I humorously but sincerely ask you the question, who should I let have their way with me? My challenge to all of us as Christians is, indeed, let us be accountable to God for the gifts and the resources God has given. Let it begin with us, our families, our church community, perhaps our local government, but let it be done freely. When we look to someone else to take away freedoms of our neighbors in order to try to create a perfect world, history's not full of good examples of that.
But I would say let it begin, and I think that's one of the big problems. It doesn't begin.
In my siblings and their spouses, I count a nurse, 3 doctors, and a health insurance administrator. All of them feel that they're under attack. The free market system and the profit motive have been kind of brought into question tonight. The supply and demand issue I'm dealing with is where the doctor's going to come from when they are essentially under attack. I don't think the government knows how to produce an abundance of good health care, but I do know that the government can produce a lack of health care by driving good people out of the profession. And I'd just like to hear your thoughts on what the Christian solution to that problem would be.
It reminds me of a meeting about 15 years ago, which the state Medicaid director and I were asked to go to the Virginia chapter of American Academy of Pediatrics statewide meeting. And at that time, managed care was just coming in. Most docs were self-employed or employed as a group amongst themselves. And the question was raised, how many of you would be willing to be employed at $120,000 a year with your malpractice covered and coverage, call every third weekend? Well, not many hands came up, but look what's happened since. I think most every physician in America today is employed by some other organization other than what it used to be in the past, where they controlled their business. And docs have taken criticism for some of the activities in the past because they owned a lot of the hospitals and other service delivery systems. They've tried to combat this transition over the last several years by purchasing their own ambulatory surgical centers that they ran, they managed. But I think there's a huge volume of physicians out there that are physicians and other healthcare providers that are very distraught with the healthcare system today. How are we replacing that? I think there's still hope. There's a number of physicians young people coming into the field who still have this sense of hope that they can provide care and make a difference in people's lives. The system itself may shift, though, more towards nurse practitioners and PAs and other allied health providers to provide the care that people need.
And I think that would be not unreasonable, that a lot of basic health care can be delivered by people who don't require as much training and therefore are not as expensive to employ. That would be a way of spreading it out. And I would not be offended. I think that would be a great idea.
Yeah, but we don't want to go back to, I think, where we use, for example, lay midwives to deliver babies in our homes. I think it just puts babies and mothers at risk. Yeah, and there's that kind of thing kind of pushing, and those other kinds of healthcare, illness care systems that, and not that I think pregnancy is a medical care, needs, it's a natural biologic process, but 5% of women will get into trouble at the time of delivery.
This has been a presentation of the Richmond Center for Christian Study. If you would like to obtain more information about the Study Center, or if you would like to support the center, please visit us on the web at richmondstudycenter.org. We trust that this and future presentations of the Study Center will be used of God to bring gospel transformation to every area of your life and to the culture we live in.